Welcome. Today we're diving into the world of atherosclerosis, a condition that affects millions globally. You might have heard the term before, but what does it really mean? In simple terms, atherosclerosis is a disease where your arteries become narrowed and hardened due to a buildup of plaque. This process can start early in life and develop silently over decades, often without any symptoms until it becomes severe. Understanding atherosclerosis is crucial because it's a leading cause of heart attacks and strokes. Let's explore how this condition develops, what causes it, and why it matters for your health. To understand atherosclerosis, let's first talk about arteries. Arteries are blood vessels that carry oxygen-rich blood from your heart to the rest of your body. They are like highways for your blood, ensuring every organ and tissue gets the nutrients and oxygen it needs to function. Healthy arteries are flexible and smooth inside, allowing blood to flow freely. But when something goes wrong, these vital pathways can become blocked or narrowed, leading to serious health problems. Now let's see what happens inside these arteries during atherosclerosis. Atherosclerosis starts when the inner lining of an artery, called the endothelium, gets damaged. This damage can be caused by high blood pressure, smoking, high cholesterol, or even diabetes. Once the lining is injured, cholesterol and other substances in the blood start to stick to the artery wall. Over time, these materials build up and form a sticky fatty deposit known as plaque. Plaque is made up of fat, cholesterol, calcium, and other substances found in the blood. This is the first step in the development of atherosclerosis. Plaque is a combination of fatty substances, cholesterol, cellular waste products, calcium, and fibrin, a clotting material in the blood. As plaque builds up, it makes the artery walls thicker and less flexible. This process is often called hardening of the arteries. The more plaque that accumulates, the narrower the artery becomes, restricting blood flow. Over time, this can lead to serious complications, including heart attacks and strokes. Let's look at how plaque buildup affects blood flow. As plaque continues to build up, the space inside the artery known as the lumen gets smaller. This narrowing limits the amount of blood that can pass through, which means less oxygen and nutrients reach your organs and tissues. When the arteries supplying your heart are affected, it can cause chest pain, also known as angina. If the arteries to your brain are involved, it can lead to a stroke. The narrowing process is gradual, but its effects can be life-changing. Atherosclerosis often develops silently over many years. Most people don't notice any symptoms until an artery is so narrowed or blocked that it can't supply enough blood to organs and tissues. Symptoms depend on which arteries are affected. For example, if the heart's arteries are involved, you might feel chest pain or shortness of breath. If it's the arteries in your legs, you may experience pain while walking. Sometimes the first sign is a heart attack or stroke. Several factors can increase your risk of developing atherosclerosis. These include high blood pressure, high cholesterol, smoking, diabetes, obesity, lack of physical activity, and an unhealthy diet. Family history also plays a role. If your parents or siblings had heart disease, your risk is higher. Understanding these risk factors is the first step toward prevention. Let's break down each risk factor in more detail. High blood pressure or hypertension puts extra force against the artery walls. Over time, this pressure can damage the endothelium, making it easier for cholesterol and other substances to stick and form plaque. Managing blood pressure through lifestyle changes and medication is crucial for reducing your risk of atherosclerosis and its complications. Cholesterol is a fatty substance found in your blood. While your body needs some cholesterol to function, too much can be harmful. High levels of LDL or bad cholesterol contribute to plaque formation in the arteries. On the other hand, HDL or good cholesterol helps remove cholesterol from the bloodstream. Keeping your cholesterol levels in check is a key part of preventing atherosclerosis. Smoking is a major risk factor for atherosclerosis. The chemicals in tobacco smoke damage the endothelium, increase blood pressure, and lower good cholesterol levels. Smoking also makes blood more likely to clot, which can further block narrowed arteries. Quitting smoking is one of the most effective ways to protect your arteries and overall heart health. People with diabetes have higher blood sugar levels, which can damage the arteries over time. High blood sugar promotes inflammation and makes it easier for plaque to form. Managing diabetes through diet, exercise, and medication is essential for reducing the risk of atherosclerosis and its complications. Carrying excess weight and not getting enough physical activity are both linked to a higher risk of atherosclerosis. Obesity often leads to high blood pressure, high cholesterol, and diabetes, all risk factors for artery disease. Regular exercise and maintaining a healthy weight can help keep your arteries clear and flexible. A diet high in saturated fats, trans fats, and cholesterol can raise your blood cholesterol levels and promote plaque buildup. Eating plenty of fruits, vegetables, whole grains, and healthy fats can help protect your arteries. Making smart food choices is a powerful way to lower your risk of atherosclerosis. Genetics play a significant role in your risk for atherosclerosis. If your parents or siblings have had heart disease or strokes, you may be more likely to develop the condition yourself. While you can't change your genes, knowing your family history can help you and your doctor take steps to prevent problems before they start. Atherosclerosis is a slow, progressive disease. It can start in childhood and worsen over decades. As plaque builds up, the artery walls become thicker and less elastic. Eventually, the plaque can rupture, leading to the formation of a blood clot. This clot can block the artery completely, causing a heart attack or stroke. Let's look at what happens when plaque ruptures. When plaque becomes unstable, it can rupture or break open. This exposes the inner contents of the plaque to the bloodstream, triggering the body's clotting system. A blood clot or thrombus can quickly form at the site. If the clot is large enough, it can completely block the artery, cutting off blood supply to vital organs. This is the main cause of heart attacks and many strokes. A heart attack or myocardial infarction happens when a blood clot blocks one of the arteries supplying the heart muscle. Without oxygen-rich blood, part of the heart muscle begins to die. Symptoms can include chest pain, shortness of breath, nausea, and sweating. Immediate medical attention is critical to save heart tissue and improve outcomes. A stroke occurs when a blood clot blocks an artery in the brain or when a blood vessel bursts. In atherosclerosis, the most common type is an ischemic stroke caused by a blocked artery. Brain cells begin to die within minutes without oxygen. Symptoms include sudden weakness, confusion, trouble speaking, or loss of vision. Quick action is essential for recovery. Atherosclerosis doesn't just affect the heart and brain. It can also narrow arteries in the legs and arms, leading to peripheral artery disease (PAD). PAD causes pain, numbness, and sometimes sores that don't heal. In severe cases, it can lead to tissue death and even amputation. Early detection and treatment are important for maintaining mobility and quality of life. Atherosclerosis can also cause other problems such as aneurysms, bulges in the artery wall that can burst and cause life-threatening bleeding. It may also lead to chronic kidney disease if the arteries supplying the kidneys are affected. The complications depend on which arteries are involved and how severe the blockage is. Doctors use several tests to diagnose atherosclerosis. These may include blood tests to check cholesterol levels, imaging tests like ultrasound or CT scans to look at arteries, and stress tests to see how your heart works under pressure. Early diagnosis is key to preventing serious complications and starting treatment. The good news is that atherosclerosis can often be prevented or slowed down with healthy lifestyle choices. Eating a balanced diet, exercising regularly, not smoking, and maintaining a healthy weight all help protect your arteries. Even small changes can make a big difference over time. Prevention is always better than cure. Doctors may prescribe medications to help control risk factors and slow the progression of atherosclerosis. These can include statins to lower cholesterol, blood pressure medicines, and drugs to prevent blood clots. Taking medications as directed is important for reducing the risk of heart attacks and strokes. In some cases, surgery may be needed to restore blood flow. Procedures like angioplasty use a tiny balloon to open up blocked arteries, sometimes with a stent to keep them open. In severe cases, bypass surgery creates a new route for blood to flow around the blockage. These treatments can save lives and improve quality of life. A diagnosis of atherosclerosis can be overwhelming, but many people live long, healthy lives with the condition. Managing risk factors, taking medications, and following your doctor's advice are key. Regular checkups and a healthy lifestyle can help you stay active and reduce the risk of complications. Surprisingly, atherosclerosis can begin in childhood. Studies have found early signs of plaque in the arteries of teenagers and young adults. This highlights the importance of healthy habits from a young age, like eating well, staying active, and avoiding smoking, to prevent problems later in life. Atherosclerosis is a leading cause of death and disability worldwide. It contributes to heart disease, stroke, and other serious conditions. The burden is especially high in countries with unhealthy diets, high rates of smoking, and limited access to health care. Global efforts to promote heart health are essential for reducing the impact of this disease. Scientists are constantly researching new ways to prevent, diagnose, and treat atherosclerosis. Advances in genetics, imaging, and medications are helping us understand the disease better and develop more effective treatments. The future holds promise for earlier detection and improved outcomes for people with atherosclerosis. To sum up, atherosclerosis is a common but serious condition where plaque builds up inside the arteries, leading to narrowing, reduced blood flow, and potentially life-threatening complications. The good news is that many risk factors are controllable. By making healthy choices and working with your healthcare provider, you can lower your risk and protect your heart and arteries. Atherosclerosis is a chronic disease characterized by the buildup of plaque inside the arteries. This plaque is made up of fats, cholesterol, calcium, and other substances found in the blood. Over time, the plaque hardens and narrows the arteries, limiting the flow of oxygen-rich blood to organs and tissues. Atherosclerosis can affect any artery in the body, including those in the heart, brain, arms, legs, pelvis, and kidneys. It is a leading cause of heart attacks, strokes, and peripheral vascular disease.